Hello, it is another week of Issues in Focus, and I am here be talking about this because I have looked at all the issues and I think healthcare pops out as the one that we should be talking about. Yes, healthcare. President Obama this week has stepped out, had a town hall meeting, called his supporters of those who work with Organizing for America to say this is the week, this is the time. This is 6 months into his presidency. I promise healthcare reform, and I'm ready to see it happen. Yes, the president, despite all that he has on the table, despite that the economy is still hopping, as they say, picking up, but jobs are still few and far between. He's saying that we can't stand still. We need to continue. We need to walk and chew gum. And this week, yes, he boldly decided to throw out the issue of healthcare reform. So this is Issues in Focus, and I think that's the right thing to do. I think the timing is right because, as he said, if it's not done in the first year of his presidency, it will not happen. It's now or never. Yes, believe it, it's now or never. So we're talking healthcare. So my question to you is, are you one of those who believe that healthcare should be a right or a privilege? Yeah, two schools of thought on the issue. Are you one of those who believe that should you get sick, should you be allowed an opportunity to get the best access to care, access and quality to care where it is? Should it be that if you can't afford it, you should have to go to a dark, dimly lit place in a shed somewhere and be allowed to die? Do you, as an American citizen, as I am and as so many are, believe that we are a valuable human resource, and if our country has a good healthcare system, it will in turn help in terms of our productivity, in terms of how well we work in the marketplace, in terms of how we contribute to healthier families and healthier living? I say yes to all of those. You can say no because, as I said, this is just a discussion, and I invite everyone and each one of us to the table with our various points of view. It's only through discussions that we will come to the right answer. But I do think this is a time for healthcare reform. I do think this is a time for us to say, this is it. We cannot continue this way. Yes, we cannot continue this way because many people right now have private insurance, only to find out if a serious condition comes up, they are not covered at all. So there's an adage out there that if you have private insurance, don't kid yourself. Don't kid yourself. If you have private insurance, it is like wearing a hospital gown. You think you're covered, but you're not. Think again. The last time you went to the hospital and someone gave you a hospital gown, were you covered? I've been through that situation, and I'm not. So if that's the comparison we think of when we think private health care insurance, we need to think again. Many people are saying that this is the time for private and public to have, do two different systems, so the true competition, we can have what we are actually looking for. There's a group called Physicians for National Health Program. I repeat, there's a group called Physicians for a National Health Program, and they are recommending the single-payer system. They said it's not what people make you think. It could work if it was given a chance. Others are saying we don't want to hear about it because anything that has to do with a little bit of public never works. I say let's pause. We who believe in the free marketplace, we still do. Most of us believe that if we turned our monies over to Wall Street, private companies, the best minds would be there to manage. We see what's happening. We see the results. We're in a deep recession, and the people who are responsible have walked away, most of them without any punitive, meaning they were not punished, and our monies are gone, and the best minds were told, if you put it in Wall Street, put it in the hands of a broker, they'll do it for you. It didn't happen. What I'm trying to say, we need to go into healthcare with an open mind. We need to talk about this to the extent that we will come up with the right solutions. But again, what should be the answer? Some people are talking universal healthcare. Others are saying we should continue to do private. We are saying 45 million Americans right now or more have no health insurance. Another large percentage who think they have insurance are inadequately covered. Where does the answer lie? Physicians for National Health Care Programs Some of them demonstrated recently in Washington, and they are saying something must be done. I read an article on the Huffington Post where people are saying AMA is not speaking for the patient, but is only speaking about the doctor and their reimbursement. I am not saying this what it is. I don't have all the facts. I can only say the ideas out there that the doctor, who should be the advocate for some of us, isn't. We want our doctors to be paid, rightly so. I want to know my primary care physician is being paid and reimbursed, for what he or she does. So goes the surgeon. But as I said, when we talk healthcare, who should be the advocate for the patient? His or her doctor. So I hope that when all of this, the dust up dies down, we will be able to settle down on this issue of healthcare. The time is right for healthcare reform. It's now or never. What are your thoughts? As I said, I welcome you to leave a comment on this blog. I welcome you to join me on I welcome you to leave a comment on this video. I welcome you also to join me at my blog, vernasmith.com. I welcome you to join me at my blog, vernasmith.com. Let's get into the conversation. Let's tell ourselves we have a right to be a part of this dialogue. As I said, the president in the town hall meeting addressed this. People in town groups last week were talking about this. It's the headlines in the newspaper. It's everywhere. And I said for this week, my goal and my topic is healthcare reform. Are you ready? Healthcare reform, now or never. Healthcare reform, do we deserve to see a better system? I look forward to your answers. Again, I am Verna Smith. This has been Issues in Focus. And as I said, join the conversation. Thank you.